Are you confused about Medicare and the coverage that you need? Open enrollment coming around the corner October 15th. With me today, Tracy Benson, S.H.I.N.E Program Manager for Barnstable County. This is such a huge topic for seniors in our community. Tell us first, what is S.H.I.N.E? It's an acronym for something.
It is an acronym. It stands for Serving the Health Information Needs of Everyone. And when we say everyone, it's really everyone on Medicare. So you could be under 65 disabled and have Medicare, and then you also may be eligible for Medicare when you turn 65. So we have two different populations that we serve.
Okay. And as program manager for the county, it's your responsibility to kind of train all these volunteers up?
Yes. So anyone that would be interested in volunteering for S.H.I.N.E would have to go through a very intense training. It's about 8 to 10 days, full days of training, and then we have monthly meetings that one would have to attend. And we just go over the information again every month.
Okay.
So.
And these counselors are trained specifically on what people would need for insurance?
Well, it's A to Z
that.
Medicare. Yeah, so it's what Medicare is, how one would navigate through Medicare, and then really all the options that go along with original Medicare, like maybe a supplemental policy or a prescription plan, or maybe even a Medicare Advantage plan. So there are a lot of options that come with original Medicare that's fairly hard to navigate through, and that's really what a S.H.I.N.E counselor, we're teaching them all of that in hopes to communicate to the beneficiaries.
Okay, so I went through this recently with a couple of family members signing up for Medicare, which is confusing unto itself.
Yes.
Yes. And then realizing that it doesn't cover everything. So S.H.I.N.E counselors can help you understand the insurance coverage at the bare bones of Medicare, and then what do you have to add to it?
So typically, yes. So original Medicare is really what we would consider Medicare A and B, and that's not 100% coverage. So even if you were to walk around with your Medicare card, you know, you have a lot of out-of-pocket expenses. On the medical side, 20%. On the hospital side, you have a fairly large deductible, as well as a deductible on the medical side. So even just original Medicare, although good coverage, definitely has some what we would call gaps in coverage. And original Medicare does not cover prescriptions, which everyone should have that prescription coverage. So we have to think of ways of, okay, I have this Medicare coverage, I know it has some gaps in it, I understand it doesn't have prescription coverage, now how do I fill in those gaps? And that's really what a S.H.I.N.E counselor would be talking to you about. You know, what are your finances, what is your health, how do you feel about risk, what kind of things would be the best options for you?
Okay, and that really brings us to coverage. When we talk about the different types of insurances, for example, if you have prescriptions currently, you're going to need a fairly robust prescription plan.
Right, so we want everyone to carry prescription coverage, and in fact there is a penalty if you do not carry prescription coverage. So we really do try to encourage everyone, even if you're not on medications, to carry a prescription plan, because you can't predict the future on that.
Right.
And a prescription plan is really as good as what's going to cover your medications. So whether it's on the lower end of a premium or a high-end type of premium plan, you know, the best plan for you may not be the best plan for me, because it's strictly based on your medications. Out of all options, we're trying to find that one plan that covers what you are on as an individual and allows you to go to the pharmacy that you would prefer to go to, because that's another important piece, and we kind of look at those two things together to find you the best drug plan.
Okay, and then saving money too, that seems like a misnomer when we talk about healthcare these days.
Yes.
But there were plans out there which I thought were interesting. So one of my family members is really healthy, doesn't have any prescriptions at all, and another is on dialysis. So these ways to save money, does a S.H.I.N.E counselor work with the insurance companies or no?
We're going to be giving you unbiased information, so we're not getting incentives from any of the insurance companies. We're really just trying to find out of all the options, which is the best one that's going to cover you, that you find affordable, and is really just going to give you the best coverage without breaking the bank. Right. And these plans change from year to year, which is why open enrollment becomes very important to you to take a look at what do you have for plans, what's changing with those plans, And you just want to be on the best plan that's going to save you the amount of money that you want to save.
Right. So the S.H.I.N counselor really literally is independent.
Independent.
And is their mandate, their purview really literally is just to help you save money and find the right plan that fits you.
It really is all about finding the right plan that fits you. We don't want to see anyone overpaying because they didn't understand something, or picking a really high-priced policy because they feel like the more I pay, the better that policy might be, because that's not always the case. And so we really just try to help them navigate that, because it's very difficult.
It is really difficult.
Yeah.
And then let's talk a little bit about all these words that get bandied about. The Advantage Plan. That's very confusing.
Very
They
confusing.
sound like they're the best plan, but they're just words, right?
They are just words. And you'll hear those same words, advantage, quite frequently. Okay. And it really boils down to who do you want to be your primary insurance carrier is really what it boils down to a lot of the times. Advantage plans are, we could describe them almost as replacement plans, because Medicare Advantage plans become your primary insurance carrier. And when something is your primary insurance carrier, say it be a Tufts or a Blue Cross, those are the physicians that you're going to be allowed to go to. Where if you had Original Medicare as your primary insurance carrier, the network is a little bit larger, because you can really see anyone in the country who accepts that has signed the Medicare contract. So they're very, very different things. Original Medicare and, say, a supplement versus a Medicare Advantage plan.
Okay. And we'd noticed that even in our own searches that some people don't actually, doctor's offices carry the Medicare. So you do need those supplemental plans to actually get a primary care some days.
The Medicare Advantage plans are separate contracts, so a lot of physicians may not sign a Medicare Advantage plan contract, although a lot of them or most of them are still signing the Medicare contract. That's why you really need to understand who is your primary insurance carrier, because if you've replaced Medicare with a local company, then you may not be able to see the physician that you want to go see if they haven't signed that contract. So there is a lot that goes into it. It's very network-based, and that's why we're really here to try to make sure that everyone is on the right plan. And the commercials look great, but you want to make sure you're really researching what it is you're enrolling in.
Right. Those mailers that people get at their houses too, they seem to be designed to confuse you, to say, this is the only plan that you can get. But no, there's a lot of different plans. Even here in Massachusetts, which we're a little more strict on our insurance plans, there's a lot of carriers.
There are still a lot of carriers, and yes, they're all vying for your attention. So those mailers and the advertisements on TV are always going to look like they're selling the greatest things since sliced bread. And it may be for you if you've done the research. If all the stars align, I tell people, then perhaps that is a nice policy for you. But sometimes something's not going to align for you. They may not cover your medications. They may not allow you to go see a physician that you've had a relationship with. So you don't want to get stuck in something that's just not going to be the right plan for you.
Right. And some of these plans, dental, vision, are those all wrapped into some of these plans as
Medicare
well?
Advantage plans, because they are network-based, so they are sometimes going to restrict where you can go. So what they have done to maybe offset some of that is they will have additional benefits that, say, Original Medicare doesn't have. And a lot of them, the dental, the vision, some of them have hearing. Those are the key things that people are looking for that Medicare may not cover. And so as an incentive for these plans, they're going to offer those benefits. May be worth it, may not, You may pick that plan because it has great dental, but if you can't see your doctor, then that's not going to work for you.
So we've talked about plans where we kind of understand that we need help. The whole application process to this is mind-boggling. Never mind for somebody who might be internet savvy. But for those who aren't, is there help with a S.H.I.N counselor for applying for things like this?
Sure. So if you meet with a S.H.I.N counselor one-on-one, if you have the ability or want to enroll yourself after you've made the decision, then that's fine, but we also will help you enroll. I do a lot of the enrolling right in my office with clients.
That's
Just
fantastic.
get it done so that when they leave, everything is all set and they don't have to think about it.
Right. And you're not the only one out there. Our senior center in Barnstable has wonderful S.H.I.N counselors as well. So tell us a little bit about the network of S.H.I.N counselors. How can people find this help?
So S.H.I.N.E counselors, for Cape Cod and the islands, I have about 60 S.H.I.N.E counselors that cover the region, plus myself. So the best way to find a S.H.I.N.E counselor is probably to contact your local senior center. The only senior center that does not have a S.H.I.N.E counselor would be Wellfleet. So if you're from Wellfleet, you can contact me at the regional office, and I'm happy to help. I'm happy to help really anyone if they can't get in touch with their local S.H.I.N.E counselor at their local senior center, but that's probably the best way to reach a S.H.I.N.E counselor, is to contact their local senior center.
And we know Barnstable Senior Center has...
They have many S.H.I.N.E counselors there. Many of our sites have multiple S.H.I.N.E counselors.
Right.
And they will be busy during open enrollment. So call early if you want the appointment, and then at the regional office, we can see anybody.
Okay. And even though you have all of this done, open enrollment, you mentioned this earlier, but I want to kind of stress this for folks. You really want to take a look at your insurance now.
Yes. So open enrollment is everyone on Medicare's opportunity to take a look at what they have, what's changing going into 2019. So you're going to think about your finances, you're going to think about your health, you're going to look at your medications, and you're going to think to yourself, you know, am I overpaying? Is there something out there that's a little less money, maybe more comprehensive coverage? This is the time. This is the window to really take a look at what's going on and make changes so that when January 1st comes, you feel confident and good about the coverage that you have.
So that's October 15th through
December 7th is the last day.
Okay.
And once that window shuts, you know, there are other windows, but this is the biggest one. So it really is a great opportunity, and I really encourage everyone to take a look at what's going on. Because you may feel like what you have is working, and it might be working, but there might be something else out there that will work just as well and maybe be a little less money. So we're all about trying to save money, as you know, we all are. So if there's an opportunity to do so, you know, it's worth a 15-minute sit down or a conversation with a S.H.I.N.E counselor to make sure that you're on the best thing for you at the lowest price possible.
This was fantastic information, Tracy. Thanks so much for
thank
joining
you. Thank you
us.
for having me.